Thank you for watching my proposed intervention in quantitative research question presentation. Here is the order of the presentation. In the United States, approximately 40% of teachers leave the classroom within their first 5 years of teaching. The retention of novice teachers, or a teacher with 0 to 5 years of experience, is a pressing issue because their attrition correlates with student achievement and school budget. When teachers leave the profession, their roles are usually filled by another novice teacher, who tends to perform poorly in comparison to their veteran peers when examining student academic performance. Additionally, recruiting, hiring, and training the new teacher costs approximately $14,500 per leaver per school year. This study focuses primarily on novice teachers who are a part of a teacher development program, which, for the purpose of the study, will be referred to using the pseudonym United States Teacher Academy, or USTA. USTA is a nonprofit organization that recruits high-performing college graduates to commit to teaching for a 2-year period in an urban school district. According to USTA's internal record, by March of the 2018-2019 school year, 19.5% of the organization's 3,500 teachers were emergency released or resigned from the organization due to health reasons. Here is my updated problem of practice. For the needs assessment, 46 of USTA's 190 members completed a Google form. This was a response rate of 24.2%. Analyzing the needs assessment revealed 3 main points. The first is that most participating novice teachers were seeking roles in education such as administration, educational policy, or education nonprofit organization. To be more precise, only 6.5% of the participants wanted to be lifelong teachers. 10.8% indicated a desire to become a school administrator. 41.3% would like to hold an educational role outside of a school setting. And the remaining 41.3% were interested in occupations outside of education completely. The second point was that the highest source of pressure in their jobs were stressors intrinsic to their roles. These include things like there being a lack of resources, having to deal with behaviors, completing administrative tasks, the low salaries, or having to be a part of a constantly changing environment. When looking at the subscales of burnout, most of the participants were experiencing emotional exhaustion, meaning they feel as though they have no more to give psychologically. Lastly, of the participants who did desire to teach in the classroom long term, they all had higher levels of self-efficacy along all 3 subscales. Moreover, they also had lower indications of burnout on all 3 subscales. After the needs assessment, I conducted a review of intervention literature. 4 main points were important for me to consider when proposing an intervention. The first is that there is limited research on the impact of interventions related to factors on the chronosystem and macrosystem level, since these factors are often outside of the researcher's control. The same could be said about my locus of control going into implementing an intervention. Secondly, much research surrounds the impact of teacher induction programs. However, many utilize weak research designs. This was important to note because, as a director of institute for the organization, my role is to develop an induction program for incoming teachers. 3, building teacher self-efficacy and resilience were both studied as a means of not only increasing retention, but showed connections with reducing occupational stress. This was something that I wanted my proposed intervention to include. Lastly, previous interventions for decreasing occupational stress and increasing wellness for both teachers and clinicians alike focus more on the individual factors than the contextual factors, such as the structure of the organization or policies within the organization. Doing so puts the onus of occupational stress on the educators themselves rather than the root cause. Knowing this, I wanted my intervention to involve some type of change in the organizational structure. To conduct this intervention, my plan is to administer a pre-survey that will measure self-efficacy, occupational stress, resilience, and self-proclaimed retention intent in the participants. This survey will look very similar to the need survey. Not only will those in the test group, those who are participating in the bailing groups, receive this survey, but those in the control group, those who are not participating in the bailing groups, will also receive this survey. Afterwards, participants will be placed into groups of 4 with the addition of 2 USTA alumni and a licensed clinician. The licensed clinician will be there to support the mental health needs of the teachers, and the USTA alumni will not only be participating in the bailing groups, but will serve as mentors to those participants as they have more experience in the classroom. These participants will set up bi-weekly dates to meet with their group and discuss potential topics. These topics will be generated by the group members so that they have onus over what they want to discuss and how they want to grow. At the end of the year, with participating in the bailing groups, participants in the control group and the test group will both receive the same survey to measure any changes. My quantitative research question would be, what is the relationship between participant in the bailing groups and teacher's self-expressed intent to persist in the classroom? As a means of increasing perseverance and retention in the classroom, this study proposes the implementation of bailing groups. This is a practice traditionally utilized to increase the retention of general practitioners. Bailing groups were initiated in the United Kingdom post-World War II as a therapeutic tool in response to the burnout and compassion fatigue experienced by general patient doctors. Burnout is emotional, physical, and mental exhaustion caused by sustained involvement in emotionally draining work. Compassion fatigue is the sudden onset of fatigue caused by working with individuals who experience stressful events combined with empathy for the individual's clients. In this case, the clients would be the teacher's students. In bailing groups, doctors meet in small groups of 8 to 12 to discuss patients who are causing reactions in their lives. The groups are traditionally facilitated by a psychoanalyst. Similar to teachers, general practitioners work in isolation. Thus, the bailing groups will allow teachers to have peer support in managing their own mental health.